Harmful levels of alcohol have become part of many people's everyday lives during the pandemic. That's according to a leading charity. In 2020, Wales recorded its highest number of alcohol-related deaths for 20 years. And referrals to the charity Barod have increased by 41% compared to pre-pandemic levels. Charanpreet Kera has been talking to a man whose drinking hit crisis point during lockdown.
Pre-lockdown, I would take a Lucozade litre bottle with me, tip the Lucozade out, half fill it with vodka and then half fill it with Coca-Cola. And on a couple of jobs, people could smell it on me. Lockdown, great. I didn't have to work. I couldn't work anymore, so I didn't have to make that effort. Mum passed away at the end of February, not suddenly, expected. And just when I thought I couldn't increase my drinking anymore, I did. And I was just a complete mess, completely out of it with acute liver failure and the neuropsychiatric result of my liver not cleaning up the biotoxins in the body. I was hallucinating and having the wildest nightmares and dreams. And that's when when I eventually came to, I was like, something needs to change.
Rick spent 7 weeks in hospital with acute liver failure and hepatic encephalopathy. His liver so damaged by alcohol that toxins from his blood entered his brain, causing those terrible hallucinations. At Bronglaze Hospital in Aberystwyth, stories like his are becoming more common.
It's given people who possibly did drink 1 or 2 every evening the opportunity to drink maybe 3 or 4, and that's normalised for them. There's a risk to drinking any alcohol, but once you go over that limit, your risk of any cardiovascular disease, respiratory disease, liver disease, it all increases.
With those increases normalised during lockdown, many are feeling the impact when it's too late.
A lot of patients are telling us that they didn't access GPs during the pandemic. When they are referred by the GP now, their liver health is so much worse than what it could have been had they accessed support earlier, that we're missing the boat of being able to just reduce drinking.
Because of this.
By the time Rick went into hospital, his life was in danger because of alcohol. But even before the pandemic, it was impacting his job as a pub manager and his family too.
You forget how much children actually are aware and how much they are seeing. We'd just be in the pub, like I grew up in pubs. There'd be like TripAdvisor reviews on a pub that he was managing about how he was, there was a smelly man behind the bar, he was always drunk, and it was really weird to be able to read other people's opinions about my dad who don't know him.
Bless her, she's put up with me for a lot and always stood by my side, and she's been with me through thick and thin. However, I'm sure there's been times where she's absolutely detested me because alcohol was my priority, not my daughter.
Now Rick's mending his relationship with his daughter by mending himself, running groups like this Bull Club for others in recovery and studying substance misuse to help others on the same journey he's taken.
And if you've been affected by any of the issues raised in that story, details of organisations that can provide information and support is available on the BBC Action Line website.